Yeah, it is a little gloomy here this morning. I can say that. It's cloudy, drizzly, rained all day yesterday, but that's actually pretty good because we on Sunday, Brandon put out about a ton of pasture seed, and so we needed a little bit of rain to make it grow. So this was good. This was good. So people are saying Facebook has totally changed everything, uh, and there's a new format, and I really don't like it. But you kind of don't have a choice. So where on the left side there used to be a bunch of tabs, and it had the videos over there and a bunch of other stuff. That's now up top. There's three little dots or something. It says more. Click on that. Then there's a tab there for the videos. I've had to go find them for people. And here's a trick that you can use if you're looking for, like somebody emailed me yesterday and they said, have you done any videos on, I forget what it was, elevated liver enzymes? And I know I've done that one multiple times. So I just went to my search engine and I typed in Dr. Judy Morgan liver enzymes. And it brought up about 20 things that I've published on that topic. And then you can click on that, and it'll either take you to a Facebook video or it'll take you to a blog. Sometimes you get a 404 page not found, and that's because that was on my old website and hasn't. It's taking you to the old website that doesn't exist anymore. So just click a different link. But it's funny because Hugh and I were looking for the video the other day from the first book, the Needles, wherever it is, the Needles to Natural book. God, it's like working in a mirror. And so I'm scrolling back through 5 years of Facebook posts, and it's taking forever because I'm trying to load videos. And finally, I just went, duh, just put it in the search engine. I put it in the search engine, boom, there it was. So that's the easiest way to find old things. Scrolling back through old videos on Facebook, there's thousands of them, so it will take you a long time for all of them to load unless you have like an incredibly fast internet, which we don't here, so it's slow. Anyway, what am I going to do if Facebook goes away? I hope it doesn't go away because we've built a huge platform here. I don't. I have my issues with Facebook, but we have built a huge platform, and it has been a way to get my message out. And we are over 71,000 followers now. So, yeah, it's a little frustrating. And some people have left Facebook, and they're saying to me, are you going to post everything to YouTube? And that's a lot of work, guys. Gwen is actually working on doing a private platform where we can move to basically our website or a private server. But again, we'd have to build that platform from scratch. A bunch of you would follow us instantly, but a lot of you, especially newer people, it'd be hard, to attract new people. So it's always a game. Anyway, so we got bad news last night. Gwen and Brandon took their two dogs to the vet because Mila has been limping very badly on her right front shoulder. She had a TPLO surgery, I think, on her left hind a couple years ago and has done beautifully with it. But now she's developed this lameness in the right front, and when she goes out to the farm, she races around like a crazy dog. And the fact that she is almost three-legged lame does not slow her down at all. The problem is when she gets home at the end of the day, boy, is she really slow then, and Gwen has to load her up on a lot of painkillers and anti-inflammatories. So she wanted to go in and get her leg checked, and she also had this annoying little lump at the top of her tail. And I had looked at it a few months ago. It was probably before we moved down here. And I said, well, the only way to know is we're going to have to get an aspirate on it. So when she had her in to have her leg looked at, she said, oh, well, can you aspirate this? And bummer, 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 it's a mast cell tumor. So she called me, and I was, still hard at work. And I said, okay, I can't focus on that right now. I'll get back to you in the morning. And, but I do have a good herbal protocol and diet protocol for mast cell tumors. So I said I can email you that in the morning, and we can get her started on supplements and herbs and things that we should use. So that was all well and good. And then for some reason I woke up this morning and went, hey, wait a minute. in my last journal of the American Veterinary Medical Association, there was an advertisement for a new product for mast cell tumors. And I went, well, duh. So got up this morning, ran and found my magazine, texted a picture of it to Gwen, and she said, yeah, they mentioned that, but the vet has never used it, and she's being sent to the oncologist at the specialty center. So she's hoping that they do. But so here we go. Seeing is believing, and you can see the pictures. Oops, again, working in the mirror. Here's the original lump. They injected it with this new thing. There's the hole where it ate the tumor, and then 6 weeks later, healed. So this stuff is called Stelfonta. It's Tigilinol Tiglate. Where do they come up with these names? Injection. And it says accidental self-injection may cause severe wound formation. Oh, goody. It eats tumors. To decrease the risk, sedation of the dog may be necessary. And dogs do not inject into subcutaneous mast cell tumors located above the elbow or hock. Uh-oh. So maybe we're not going to use it on Mila. Formation of wounds, possibly extensive, is an intended and likely response to treatment, along with associated swelling, bruising, and pain. These wounds are expected to heal. Appropriate pre- and post-treatment medications must be given, including a corticosteroid plus blocking agents for both H1 and H2 receptors, so that'd be antihistamines, in order to decrease the potential for severe systemic adverse reactions, including death from mast cell degranulation. Fun. But it says, so within hours you get visible changes, then you get tumor destruction, and then in a few weeks you have tumor site typically healed. And it says it resolves 75% of mast cell tumors with a single treatment. 2 treatments, 87%. Of the dogs achieving complete response at day 28, 96 remained disease-free at 12 weeks. Well, they didn't follow it out very long. It's an intratumoral injection indicated for use in dogs for the local treatment of non-metastatic cutaneous mast cell tumors, which means they haven't spread and they're on the skin, and non-metastatic subcutaneous under the skin tumors located at or below the elbow or the hock. So, not sure they're going to use it in Mila. I mean, that'll make a big ugly hole up at her tail base. I guess, there's a few other structures there that are closely related. I should have read all that before I sent it to Gwen. A few other structures in that area, kind of like the poop chute, that I might be worried about if she had a really major reaction to. So this is a little similar to, and I'll have to do more research on this, but it's a little similar to a product that we used a lot at our practice called neoplazine, which is an herbal. It's bloodroot. And that herbal product will eat tumors. So I would use it a lot on skin tumors. It could be injected into tumors under the skin. We had one dog from Monkey's House, Violet, I believe her name is, who had squamous cell carcinoma on her jaw, inside her mouth. And Michelle would bring her in to have her sedated and have the neoplazine put on there every couple of months. And it never got rid of the tumor, but it did a really good job at kind of keeping it at bay. And I mean, she did incredibly well with it. So I've used the neoplazine inside bladders for transitional cell carcinoma. The animal does have to be sedated for about a half hour because it has to stay in place for that long. But on wounds on feet and legs, we used it quite often. Put it on the tumor and wrap it, leave it on there for about 12 hours, and then take it off, and then it eats a big ugly hole like in that picture, and then it heals. It was a very successful product, neoplazine. You can look it up online. It's made by Buck Mountain. Not too many veterinarians use it, and you have to have the right client to use it because it is going to make a big ugly hole like that, and it's going to be inflamed. And actually with the neoplazine you cannot give steroids or anti-inflammatories because we want that inflammatory response. So we used other pain meds that were not anti-inflammatories, but it was very popular. I had one the first time I ever used it. We had a dog, an older dog with a mammary tumor that was ulcerated, and it was good size. and we were going to do surgery to take it off. We sedated the dog, and she immediately started having bad reactions to anesthesia with heart problems, blood pressure problems. And we said, well, that's not going to work. So we woke the dog up, and I said, well, then we're going to try this new thing, and we're going to see. It was 25 years ago, new. So we put the neoplazine on it, and put a bandage around the dog, and 10 days later there was no tumor. It was healed over beautifully, and she didn't have to go through surgery. So that was pretty amazing. We are going to we're going to start her herbal protocol today. Have to look into her diet. She is eating answers, which is a fermented food, and there's talk that maybe dogs that have histamine problems should not be on fermented foods. So I'm going to reach out to Answers and see what their take is on that. I'm not sure whether I buy into that or not, but we'll find out what they have to say. I'll go straight to the source. So, how do I feel about the Tagamet Benadryl protocol listed under lymphoma, which made no sense to me? Only thought it would work with mast cell. Oh, a lot of those things work with multiple cancers. It's sort of like using sheep dewormer or fenbendazole, levamisole for cancers. We're finding that a lot of these older simple drugs have some really good anti-cancer benefits. So I think one of the first things Gwen has to do is complete staging to make sure that there's no cancer anywhere else. So that'll probably be an abdominal ultrasound, thoracic ultrasound, certainly some lab work, checking her for any other lumps, bumps, anything anywhere else. So it's a long process, but hopefully we'll get it under control very quickly. And so I guess after she talks to the oncologist, that will determine whether they are going to try to surgically remove the mass and debulk it. Sometimes that can make them angrier. So and when you do that surgery, you need 3-centimeter borders all the way around, and that includes the deep surface as well. So again, it just depends whether it's going to be surgically amenable. So we shall see. We shall see. Okay, everybody have a great day. I'm busy working on way too many things and fighting with my computer because it ate things yesterday, but Gwen was able to recover them. Thank goodness. And luckily Gwen decided to work from here yesterday to help me out, and so my mom could babysit. And if it wasn't for Gwen, the meltdown was serious yesterday. Spent a lot of time putting together PowerPoints, and then the computer hid them. Wasn't fun. Yay, Gwen. Yeah, Mila. Yeah, we've used diet and herbal protocols for mast cells for a lot of years. Stay dry. Yeah, we're going to try. In between running around at the farm. Have a great day, everybody.